Good evening, everyone. I'm Beth Reinhardt, President and CEO of the Bristol Chamber of Commerce. Tonight, I'm representing the Region Ahead Alliance, which is a group of business and economic development leaders who have banded together across Northeast Tennessee and Southwest Virginia to promote our region and to help citizens and small businesses to meet the challenges of the COVID pandemic here and also to do our part in returning our lives to near normal as quickly as possible. The best way to stem the tide of deaths and illnesses is to vaccinate as many people as we can in our region. We know that there's a lot of information to comprehend, and with the start of vaccinations in our region, there are plenty of questions. That's why we want to thank the media partners of the Region Ahead Alliance and a group of healthcare experts who have joined us here tonight to share the best information on the two vaccines that are available today. Please note that some of the information we will share is subject to change. We will share some websites that are your best sources for updated information daily. You might want to grab a pen and a piece of paper to write down some of the information. Our guests will have important information for those living in both Southwest Virginia and Northeast Tennessee. I want to say a special thank you again to each of our panelists tonight. These are healthcare experts who are working around the clock to protect each of us and to help eradicate the COVID pandemic. So we greatly appreciate you taking the time to be with us. So let's get started, and let's begin with Dr. David Morin. Dr. Morin is Director of Clinical Research with Holston Medical Group, who led the vaccine trial efforts here in our region as a site for the Pfizer COVID vaccine. He is here to share some insights on how the vaccine was tested and its effectiveness and safety to those who received the Pfizer vaccine. So Dr. Morin, these vaccines were developed quickly, I know, as part of the federal government's Warp Speed program to find a vaccine that would protect us from the COVID virus. How did Holston Medical Group perform the clinical trials for Pfizer, and what were the results that you witnessed?
Well, thank you for asking me to be on this panel. And, it's amazing to think that Operation Warp Speed, which started at the beginning of 2020, was designed to have 300 million, their goal was to have 300 million doses of vaccine available to begin distribution by January of 2021. And here we are, and that's what we're doing now. So the achievement of that goal is just an amazing milestone in the development of a medical response to pandemic, and it has been unprecedented. And the reason for that, and as we know, we have two vaccines right now with two different manufacturers, Moderna and Pfizer, that have been authorized for emergency use by the FDA. And they're both use a technology that allows for the rapid development of the vaccine candidates, which is why this process was so fast in large part, so that those studies began with the identification of the DNA sequence of the virus as early as January. And actually by the springtime, by April, they had vaccine candidates for potential testing in the initial human trials, and ultimately went into the more trials that were looking at continued safety and effectiveness beginning in the summer of last year. We were contacted, Holston Medical Group was contacted as a potential site for for the Pfizer vaccine study, in part because we have over a 20-year history of conducting clinical trials and vaccines in both pediatrics and adults. They can be complicated studies, and the scope of this trial was enormous. We're looking at over 250 patients to be enrolled over a short period of time. We were very fortunate in that we had the resources, the expertise, and the people in the community responded so strongly that Pfizer actually allocated 2 of the 140 worldwide sites to the Tri-Cities area. So we had a location in Bristol and Tennessee. And we started the study in August of last year, and for a 6-week period of time enrolled approximately 400 patients across both the Bristol and Kingsport area. It was a 6-week period of time where none of our employees who were involved with the trial, and we had about, if you include investigators, about 20 people working on this trial, about 10 at both locations, worked almost just overtime nearly every day for 6 weeks without a day off. And they were completely energized by the fact that they were part of a process to get this vaccine out to the public, something that's so important worldwide. So we knew what our goal was, what our mission was, and we were also just energized by the heroes who joined us and volunteered to participate in these trials, knowing initially that they were going to be a 50-50 chance of getting the placebo, active drug or placebo. And many of those now, as the vaccine is being distributed to different groups, we're unblinding those and beginning to give vaccines to those that did not receive the active treatment. But this is a 2-year study. So what was shortened in this process was the vaccine candidate development using the messenger RNA technology, which we can talk about later if there's time. But also the recruitment phase across the world was very quickly ramped up so that in a period of about 6 to 8 weeks, they had 40,000 patients worldwide enrolled. That's an astounding number of patients. And that was very important so that they could get the effectiveness data to the FDA as soon as possible. And they were able to submit that by the middle of November, which was just amazing on the Pfizer trial. And Moderna was soon to follow. As far as tolerability and the effectiveness of the vaccine, both of the vaccines showed amazing effectiveness, about 95% effectiveness in reducing your chance of actually getting the virus compared to those who did. And that's amazing vaccine efficacy. If we look at the flu vaccine in comparison, it's probably closer to 50%. And yet we recommend everybody get that. So just want to reassure people the vaccine has been very effective. And also there were no safety issues with either of the studies. There were events that occurred, but most of the events that occurred were what you might expect with a vaccine. And I'll run down those for just a little bit to give some background quickly. Most people got some tenderness in their arm. Most of these symptoms were mild, did not require any treatment. Sometimes they were moderate, might require some Tylenol or something like that. About half got tired or maybe some headache. Most of the symptoms if they did occur, lasted no more than 3 days. A few, maybe 1 in 5, got some muscle aches with it, and about 10% had some kind of gastrointestinal nausea or some other gastrointestinal side effect to it. Again, most resolved within 3 days. Most of those adverse events were mild. And when you get the second shot, in the case of Pfizer at 3 weeks and Moderna at 4 weeks, the likelihood of having a side effect to the vaccine went up a little bit to that. But overall tolerability was very good. And so, you can see that the FDA required that this drug was proven to be safe and effective for the emergency use. They had strict criteria for that. And we have a lot of safety data in that. We're going to continue to collect safety and efficacy data for the period of the study, which in both cases is about 2 years.
Thank you. Thanks, Dr. Moore. And I know there's a ton more information that we could share. We're a little bit limited on our hour tonight, so we may come back to you again here in just a moment. But next, let's move on to Dr. Kershke. Dr. David Kershke is with the Northeast Tennessee Regional Health Office. His organization is responsible for working with Nashville in coordinating the vaccine shipments to Northeast Tennessee and also getting the vaccines administered here. Dr. Kershke, welcome.
Thank you.
I would like to go through a few questions, if that's all right. The first, how does the state of Tennessee allocate the vaccines to different regions across Tennessee?
Yeah, so all of the vaccine is allocated on a county population basis. So 85% or so is allocated on population basis by county population. About 5% is allocated based on what's called the Social Vulnerability Index. So distressed counties, so-called distressed counties, get a little bit of extra vaccine because of their population may be at higher risk. And then each county, so there's 10% left, each county gets at least 100 doses. So that's 10% of the total allocation, just based on, we don't want to give any county less than 100 because it's kind of hard to have a vaccine clinic with less than that. So that's basically it. It's by formula, primarily based on how many people are in the county.
Okay, thank you. Is there a charge for being vaccinated, or is that free?
Yeah, so the vaccine's free. You do have to pay for your gas that you're going to use while you're waiting in the line. So we do tell people to get in line with a full tank in case there's a wait, but yeah, vaccine is free.
Very good. The state has a vaccination website, and the URL is now up on the screen that those of you watching can see. This website allows a user to determine when they will be eligible to be vaccinated. We know that the CDC announced on January 12th some significant changes that will make more vaccines available now and different priorities for those to be vaccinated first in the process. How will that change the procedures that we have been following to date?
Yeah, well, fortunately, before the CDC came out with that, Tennessee basically changed our plan to align with that. We both were working off of the same recommendations from the advisory group that advises CDC. So currently, we're vaccinating group people in 1A, which are first responders, frontline healthcare workers, nursing homes. Most of those are done. We have a few stragglers. We're vaccinating 1A2, which are our community healthcare providers. And then the new group that was added was 75 and older. So we're currently concentrating on getting those vaccinated. After 75 and older, we'll just work down to 65 and older, and then those with underlying conditions that put them at higher risk.
Right. So the priorities that were established by the state of Tennessee for getting the vaccine that we just saw, based on what you know today, will these most likely remain the same?
Yeah, so it's hard to say with coronavirus, anything's going to remain the same. So I don't really want to predict. We've not heard of any changes. And like I said, fortunately, Tennessee had already updated their plan before the CDC came out with their new recommendation. So we think that our plan is in line with what CDC is saying already. So we expect for this to be the priority going forward. I know that the governor does want to get people 75 and older and even down to 65 and older vaccinated before we move down the other phases too far. So really maybe just a little bit more emphasis on that age-based criteria. And then soon the people with underlying conditions.
Thank you. One thing we'll hear a lot of tonight is that this information may change rapidly. It could change as soon as we finish the webinar. It could change tomorrow or next week. So please pay close attention to the websites that and the information we're sharing so that you can go to those websites to get the most current and up-to-date information. Dr. Kershke, the state of Tennessee has also developed a way to schedule your vaccination online. Do you expect that will remain the same?
Yeah, so unfortunately, probably not. The good thing is for the people that are already signing up, we don't think they're going to have to re-register on any other format. But we do know that the current method that we're using, once we get to the larger populations, like the general population in Tennessee, we need something more robust. So the state's looking at other options for that we can handle a lot more people in terms of scheduling. But for people currently, the best way to get the vaccine, if you're in one of those groups we just talked about that are being vaccinated currently, so 75 and older or in group 1A, we're also currently vaccinating 1B, which includes school teachers in the Northeast region. The best way is, if you've not signed up previously, is to go to the website and sign up through something called Sign Up Genius.
That's great information. So I've got some more questions for you. When you schedule an appointment online, what information will you need to share?
Yeah, so first, let me just mention that when you do sign up online, what's going to happen next is that we have to wait till we have enough vaccine to vaccinate people. So we have lots of people signed up. We're getting vaccine in small quantities. So we schedule people by the group that they're eligible for, and then also by who signed up first. So you will get called. It may take a while, but when we have vaccine and we're down to your group, we will contact you when and where to come. So repeat that question real quick. Well, what information? Yeah, so we don't want, no one wants your social security number or anything like that. We do need your name, your first and last name, and we need a phone number that we can contact you at, because that's how we're going to let you know when it's time for you to come get vaccinated. We also ask for an email as a backup to the phone number, but that's not required. So we know some older people may not have emails. So it's not a requirement, but it helps if for some reason we can't get a hold of you, get your phone number. You also do have to verify in the survey that you do belong to one of the groups and mark down why you're eligible for that group, whether it's phase 1A or 75 and older.
Great, thank you. So when you are vaccinated, do you get a document that proves that you have been vaccinated that you can use for travel or for you need it for your employer or other?
Yeah, there's a card. Actually, let me grab mine. So yeah, when you get vaccinated, we give you a card that has your vaccination date, which is important, and which vaccine you have. Ooh, my camera just went out of focus. So that's important for two reasons. One is that you have to get a second dose of vaccine either 21 days or 28 days afterwards, and you are supposed to get the same manufacturer vaccine from the same manufacturer as you got your first one. So that's both on here, the date that you got vaccinated and the manufacturer. So that helps, you know, both with employers, but also bring it when you're called to get your second dose, bring it just in case so the nurses can verify that you're getting the correct dose at the correct time for your second dose.
Very good. And you kind of answered my next question, but we'll repeat it just to make sure people know. How do you know which vaccine, whether it was the Pfizer or the Moderna, that you're being administered on a specific day, or which location might be administering one or the other?
Yeah, so we are giving both kinds of vaccine in different counties. We don't necessarily know very far ahead of time which vaccines we're getting in the counties. So we don't, you know, we don't advertise we're having a Moderna or a Pfizer clinic. So people may not know when they come for their first dose, which one they're necessarily going to be getting until they get up in the line, because we don't really know till the day ahead of time. The second dose, we are calling people specifically to come back at specific times to get the same kind of vaccine you got for your first dose. We've kept track of all of that in the state vaccine registry, and we're calling you back to come get that exact same vaccine for your second dose at the correct time. So the second dose, you will know which one you're getting.
Very good. Thank you, Dr. Kirschke. And as we stated, the process and locations for getting your vaccinations may change. So please keep checking the websites that we've been sharing, as that is the best way to get the latest and most current information. Next, I want to turn to Dr. Stephen May. Dr. May is with the Sullivan County Health Department, and Sullivan County is the most populous county in our region. It operates autonomously, but also in cooperation with other Northeast Tennessee counties. So thank you for being with us, Dr. May.
Thank you so much for having me.
Certainly. Dr. May, I'm going to start by asking, what are the latest priorities for those wanting to be vaccinated in Sullivan County?
In Sullivan County, we operate using the same phase scale. So 1A1s, which are the high-risk individuals working with actual COVID patients, fire, police, EMS, with community contact. And then 1A2s, which are all other healthcare workers, to include funeral workers and morticians, et cetera. And we are vaccinating age 75 and up.
Great. So where can someone go online to get the latest information on the vaccination process in Sullivan County? I know we've got another website up here. I know Sullivan County is using locations like the Dragway at Bristol Motor Speedway and the Kingsport Civic Auditorium for a lot of the mass vaccination clinics. What other locations in the county are available?
Well, currently right now, we found it best to use the large venue at Bristol Motor Speedway. We can vaccinate close to 1,000 individuals a day using that facility with our staff. And then we're doing controlled vaccinations by appointment only in the Kingsport Civic Coliseum. And with that being an indoor facility, we have to take a lot of extra precautions to ensure that we maintain distancing and all the safety measures that are important in receiving that vaccine.
Great, thank you. When do you think vaccinations will become available in other locations, such as through your private healthcare provider, pharmacies, or any other locations?
That will depend on the allocations and how fast they are able to ramp up the vaccine supply. We hope to start integrating a lot of our partners in dispensing of the vaccine, hopefully in the next 6 to 8 weeks. But once again, that is all contingent on vaccine allocation, supply, and delivery systems.
Very good. Again, great information you all are sharing. I know this is on the top of a lot of people's minds, so really good to be able to share this opportunity tonight. So thank you, Dr. May.
Oh, you're quite welcome. Glad to have you.
Now we're going to move on and speak with Dr. Karen Shelton. Karen Shelton is with the Virginia Department of Health, and we're going to ask her to discuss the process for receiving the vaccination in Southwest Virginia. So welcome, Dr. Shelton.
Thank you. Thank you for having me.
Certainly. Virginia's vaccination process, it's significantly different than those that we've just been hearing about from our Tennessee health officials. Can you begin by explaining the process for our Southwest Virginia viewers?
Yeah, so Virginia is doing things very similar to Tennessee, but slightly different. Each state is following the CDC guidance, but based on certain populations within the state and certain allocations, they may have had to roll it out differently. So in Virginia, we also started with phase 1A, according to CDC priorities and the Virginia state guidance, and that has been our healthcare providers. This has included both hospital workers as well as community healthcare providers, and has also included our long-term care facilities, both residents and employees. Another category here that we've been able to incorporate is those healthcare providers from various venues, such as our dentists, optometrists, people, physical therapists, all kinds of healthcare providers, but also our law enforcement has been an important component as those who are first responders. Many of our law enforcement provide first response medical care in the field, CPR, Narcan, things of that nature. So we've been able to include those in this phase 1A. We've been able to work with both our hospital systems and providing community hospital in providing our community healthcare workers this vaccine, as well as with our health department pods.
Thank you very much. We know that understanding the district where you live is really important. What is the process for finding when and where you should look to be vaccinated in Southwest Virginia? Is there a website?
Yes, the website was included on the first and will give you great information about vaccine in general. It also goes more into specifics of the Virginia phases, which we'll go through. Specifically, this map does show which districts are in which phases. And the next step of the Virginia process is phase 1B. Last Friday, the governor did announce that certain parts of the state would be progressing into phase 1B. And we've been very fortunate in Southwest Virginia, from Roanoke down to the tip of Lee, that we've been able to enter into phase 1B just this week. That will add additional people who can be vaccinated in our communities. This group would include those who have essential functions that are at very high risk of getting COVID because of the nature of their job, as well as those who are 75 and older. We're very excited to be able to begin vaccinating those 75 and older in our communities.
Good, really good information. So there are 3 different health districts in Southwest Virginia: Lennowisco, Mount Rogers, and the Cumberland Plateau. And there are different groups of counties and cities within each district as well. Each district, depending upon where you live, will have specific information about when and where to get your vaccination. Is that correct?
Yes, you have here the websites for all 3 health districts with specific information about vaccine. This information about vaccine is most pertinent to those who are 75 and older. In each county, we have access points for people who can be vaccinated. We have been working with Ballot Health Systems along with other hospital partners who are in other parts of our districts, as well as our local healthcare providers and pharmacies. We've been able to partner together with the health department to provide multiple points of access within the counties that those who are 75 and older can get vaccinated. All of these are listed on the website by county. And generally speaking, you call this site and the phone numbers are listed. You would call this site and they will schedule you an appointment and let you know where you need to go and get your vaccine. Like I said, several different hospital systems, and in the tip of Southwest Virginia here, Ballot Health has points of access along with pharmacies and healthcare providers. Our local health departments are also providing vaccine, but not at the local health department. We're not able to accommodate all the safety and social distancing that we need at the health department. So we have created off-site, what we call pods or points of dispensing, where people can go and get those vaccines in a COVID safe manner. So again, don't come to the health department for your vaccine. It's not there. We ask that people call and schedule and go to these off sites.
Very good. And I understand that there's also an online eligibility tool that folks in Virginia can go and use. How should you use that tool specifically?
So this tool is best for those who are in those essential function categories. Sometimes it's really hard to know which categories we might be in. So the phase 1B and the phase 1C have different work groups. So depending on your occupation, your business is depending on where your classification lies as far as eligibility to go forward with vaccine. So if you access this tool, which is actually, it's a kind of a long website there, but if you just go to the VDH Virginia vaccine website, then you'll be able to click on this tool, and this will let you know when you're eligible to receive the vaccine.
Now, I know we asked this question of the Tennessee folks, so I'll ask this for you as well. Is there a charge for being vaccinated in Virginia?
No, the vaccine does come free to us, and so we give it free to the people. And so the vaccine is free of charge. Some insurance companies, particular with local providers or our pharmacies, may charge an administrative fee to the insurance company, but there is no copay involved. And for those without insurance, there is no fee whatsoever. This is free of charge, no out-of-pocket cost for the vaccine.
Again, excellent to know that for sure, if anyone had that worry or concern. Are the priorities for those scheduled to be vaccinated the same as in Tennessee? And if not, what are Virginia's priorities?
Yes, this does make it very confusing, especially for those of us who live right on the state line. You can see, according to this slide, we do have phase 1A, 1B, and 1C. And these are according to the CDC priorities. As I've mentioned, we started with phase 1A, which was our healthcare providers and long-term care facilities. And we have now moved into phase 1B in certain portions of the state, including Southwest. And this includes those who are 75 and older, along with those who are frontline essential workers whose work places them at highest risk for getting COVID. There is a list of these. If you click on the phase, you can see a specific list of who falls into those. I will tell you that we work with employers or businesses to determine those who are eligible, and we work directly with the employers and businesses to identify their employees, and then once you're deemed eligible, then you are able to schedule a vaccine.
Great. So some Southwest Virginia counties are remote, we know. In Virginia, getting a vaccination has been explained to include some local pharmacies. Can you explain how and where Virginians can get a vaccination overall?
Mm-hmm. So in Southwest Virginia, specifically on the websites listed for each of the localities, Mount Rogers, Lenawisco, and Cumberland Plateau, you will see a listing county by county of the different points where you can access that vaccine through the hospitals, the local healthcare providers, the pharmacies, as well as the health department. Each one has a phone number you can call and schedule for vaccine.
Very good.
And that's for those who are 75 and older. Sorry.
Oh, perfect. Better to be clear than add any confusion. So thank you for that.
And for those who are, essential functions, employers should contact the health departments directly and begin to get signed up into lists. If your business is not yet eligible, we will put you on a list. And when it is time for your sector to become eligible, then we will contact you and get you going with that. So we do recommend people to contact us.
Very good. Very good. Is Virginia administering the Pfizer or the Moderna vaccine, and how can you know which one you'll receive?
Well, Virginia has a stock of both Pfizer and Moderna. We try to, and those are allocated by the state. Best thing is just when you call to schedule your appointment, or as you go for your appointment, just to ask which vaccine you are getting. As has been previously stated, we track very closely which vaccine you get. And when it comes time for your second dose, we will make sure you get from the same manufacturer.
Great, great. I know we hear this a lot. There's been some confusion regarding where you live and work and scheduling your vaccination. Let's say you live in Virginia, but you work in Tennessee because of a border location that we sit here on the state line. If I live in Virginia, but I work in Tennessee, can I get a vaccination in Tennessee, or must I go back to Virginia to be vaccinated? So, and also what about the opposite of that? If I live in Tennessee, but work in Virginia, Where do I need to look to get those vaccination schedules?
So it does make it very confusing. And again, because Tennessee and Virginia are doing slightly different things, and I just urge people to go to the websites to get more definition. But basically, if you're 75 or older, and you live in Virginia, you're eligible to get a vaccine in Virginia, and you can access those per the website. When it comes to the businesses, those are determined by the place of employment. So if you work in Virginia, then you're deemed essential business in Virginia, and we are uploading essential functions by where the business is located. So if you're working in Virginia, your employer will be contacting the health department for those who work in Virginia in essential functions.
Very good. I know that ramping up vaccinations requires a lot of specially trained personnel and a lot of coordination. How are you assuring that you have the workforce to maintain this increase in demand that I know you're seeing?
Well, we've had a demand in our need for personnel since the very beginning of the pandemic, back from the case investigators, contact tracers, testers, and now vaccinators. So we work with the state to be able to hire additional personnel for these duties.
Very good. Again, just a tremendous amount of great information. And again, referring people as often as possible back to these websites, knowing that that's where you're going to get the most accurate data. And there's contact information on there. If you have questions and you can't get the information, there are live people on phones to be able to answer a lot of those questions that people may still have. So Dr. Shelton, thank you again, not just for tonight, but all that you all are doing to help get us all safe and vaccinated.
Well, thank you. We're very excited to be bringing vaccine to the community.
Great. Well, now we are going to turn to Jamie Swift. Jamie is Chief Infection Prevention Officer with Ballot Health, and Ballot Health operates facilities in both Tennessee and Virginia. Jamie, a lot of questions are circulating about the vaccinations, so we need help with some of these answers. I'll start by asking, if a person has been diagnosed with COVID over the past months, do they need to be vaccinated?
Really the short answer is yes. So CDC recommends that vaccination be offered to everyone, regardless of their COVID-19 history. There's a couple of caveats. So we want to make sure that you are out of your isolation period and that you're recovered. And then also, if you received convalescent plasma or the monoclonal antibody treatment, you do need to wait 90 days from those treatments before you get your vaccine.
Very good. And I assume if someone goes to a vaccination clinic, they can clarify that there. Hopefully they won't do that. They'll get the information prior to going, but they can still get that information in real time.
Correct. We are asking those questions and making sure that everyone who's getting a vaccine is certainly eligible and ready.
Very good. And we get this question a lot too. I know a lot of people do. If a person is pregnant or trying to become pregnant, should they be vaccinated?
We really encourage people in that range to talk to their private physician and consult with their healthcare provider. But the American College of Obstetricians and Gynecologists has come out with some really great information. And ultimately, their final recommendation is you should not withhold vaccine just based on pregnancy. So if you're pregnant, you can get vaccine as soon as it rolls into the phase that you're eligible to receive vaccine.
And now, what about other medical conditions that might be a reason you would not want to be vaccinated?
I think we've talked a couple of times that really you want to make sure that you're not having any other illness. So if you are having a cold or a sinus infection, we want you to be healthy, not running a fever before you come in to get your vaccine. Beyond that, it's really focused on those allergies. So if you've had a severe allergic reaction to either components of the vaccine or even to some IV medications, that's going to cause some questions, and we'll talk you through that at the registration site. There's a screening station. We're going to go over all of those questions. If there is any doubt, we're going to refer you for a medical evaluation before we administer that vaccine.
Very good. So what documents should someone need to bring with them on the date of their vaccination? Like, is it their driver's license? Any other documents they might need?
Yeah, so that probably is going to vary by exactly where you get your location. I can say universally, you probably need to bring your driver's license or photo ID. As it's been mentioned, those of us who are not working for the states, we are allowed by the federal government to file insurance, and that just recoups some of those costs. again, there is no charge, no bill to the patient whatsoever. You don't have insurance, that's not a problem. But for those insurances that are paying that administration fee set forth by CMS, we are able to file that. So bring your insurance card. Some places may not ask for it, but some may.
Very good. Now, what about scheduling your second vaccination? Do you schedule that second shot? How does that work?
Again, that's really going to vary by location. So at Ballad Health, we actually use that vaccination card to go ahead while you're in our facility to give you the date and time that you're going to return. I know some of the health departments, as I mentioned, will be calling you back. And so it's really going to vary, but I assure you, when you're there and you get that first vaccine, before you leave, they're going to make sure you understand how you'll come in for your second.
That's what we like to hear. Once vaccinated, does someone receive a document that proves that they've been inoculated, and where would that document be important? I know we talked about that earlier, but just again for some clarification.
Yeah, you will. Anybody that's giving the vaccine is going to give you one of those vaccine cards. I think of it, I'll show my age, but when we were younger, you had those blue and green immunization cards. And so that's really what you're getting. It's important for a couple reasons. It's going to give you that date and the location and exactly which manufacturer. So that's kind of a second check. It's in our records, but we're going to check your vaccine card too, because we're going to make sure that you get that second dose to match exactly what you got as your first dose. It's also a good record for you to share with your private provider. Most people are not getting their vaccine through their private provider, obviously, right now. And so it's really good to take that back and let that become a part of your medical record.
Great. So once I get both vaccinations, I'm certain of not becoming infected by coronavirus. Is that correct? And can I have the peace of mind that I won't become sick or that I won't infect someone else?
Well, the protection from the vaccines and the trials, as we've shared, has been extremely well. It's about that 95% range. It's important to remember no vaccine is 100%, but 95% is about as good as you can get. There's some ongoing studies that are going to need to take place to really determine if I'm vaccinated, can I still become infected, not have symptoms, and spread it to others? So that's some data that's being studied that hopefully there will be answers in the future too.
And kind of a follow-up to that, once vaccinated, do I still need to wear my mask? Do I still need to social distance while in public?
Yeah, people usually don't like me when I answer this question, but the reason, it's kind of what we just said is right now we need this vaccine to really kind of help lower the burden of virus in the community. So we need to get the burden of virus in the community down. We need to understand if you're vaccinated, can you still spread the disease if you're exposed to it? So, I don't think it'll be forever. I think just bear with us a little bit longer. Let us get the answers to those questions that we need. And hopefully in the future, there will be some changes. But right now, even if you're vaccinated, wear that mask, still social distance, and practice good hand hygiene.
Well, and I do believe those questions come from just the strong desire for people to get back to a sense of normalcy and for us to eradicate this pandemic so that we can get back to normalcy. So certainly understand those questions.
Absolutely.
Speaking of questions, what's the number one question about the vaccination that you're hearing from the general public?
That would actually be different a few weeks ago. I think a few weeks ago, that number one question was, is it a safe vaccine? And as we've now collectively given thousands of doses right here in our region, I think people are feeling very comfortable with the vaccine. We're starting to see that uptake increase. Honestly, now it's kind of what we've talked about this entire session is, when am I available to get vaccine and where can I get it? And, they've all shared exactly how that's going to happen where you are. I would just add that as healthcare providers, we want that vaccine in your arm every bit as much as you want it. So we have really, I'm so proud of this region. We've come together to really provide vaccine together as a region to work together. And we're getting it out just as fast as we can. We're working together. We're shifting vaccine if there's a need, an urgent need. We're talking 2 and 3 times a week. And so we hear you, we want the vaccine, and we're doing everything we can to get it to you just as fast as humanly possible.
I think that's well said. And I think if there's one thing that we've all experienced on some level is even with the great challenges, whether it was from business perspective, now we're talking about getting people vaccinated, having the access to those as quickly as possible. Our community and our region has really pulled together in a tremendous and very inspirational way to really help each other and to keep us safe. So that's probably one of the greatest wins out of a tough and challenging time for sure.
It is, and I mean, it's reflected in our state data, and we get compliments all the time on just about how well this region is moving vaccine.
Great, that's what we hope to hear. Another question: what percentage of the population here in our region need to be vaccinated if we're going to truly eradicate COVID as a concern? What if we can't hit that number? What happens if we can't reach that number?
So this is a really hard question. There's really no magic number. It's not an on and off switch that all of a sudden at this number we have herd immunity. And so what we know is with every vaccine, that brings individual benefit, obviously, every single person that's protected. As those individuals are part of the community, that brings community benefit. So as more and more people have that vaccine, we start to have those breaks of breaking that chain of infection. As those chains of infection kind of build and accumulate, that's when you really start to really break that spread, and that's when you eventually get to herd immunity. But it's not to say that if we don't reach a 70% threshold or an 80% threshold, there is definite benefit in the cumulative effect of individual vaccines. As you break those individual chains of infection, you really lower that reproduction number, or those numbers of infection from each infection. As that lowers, and that's going to lower with vaccine, that's really when your community starts to benefit.
A lot of tough questions that we don't have all the answers to, obviously, but certainly doing our best to provide what we do have available. I wanted to ask about how the region's vaccination numbers are doing compared to other parts of Tennessee and Virginia, if you know that information or not.
Yeah, so we're doing extremely well in both areas. We've been able, you see in Tennessee that we've been able to progress to phases at one point in time. I think Tennessee as a whole is doing very well in the United States. Our region is doing extremely well and near the top of vaccination percentage based on population. Virginia, because they've done so well in Southwest Virginia, we've been able to move on to that 1B phase, while some other parts of the state have not. So, really moving through those phases is reflective of exactly what everyone's doing as far as getting that vaccine out.
That's great news for sure. For sure. Again, speaks to our region.
Yes.
This is a really important question, I feel. If someone is on the fence about getting their vaccination, what can you offer that might convince them that they should get vaccinated and the value of that?
Yeah, I thought about this question a lot, and I have literally spent the last year of my life working on COVID. If you look back at my social media, we were talking about it in December of 19. My first email within the Valid Health system about this concern I had was in January of 2020. So we've spent the past year working on this. And, I remember when there were 40 cases in the world, and it's heartbreaking to see the devastation that this pandemic has brought to our region, our nation, and our world. And, all of us on the screen have trained and prepared for pandemics and knew they were certainly going to be a very real thing that we experience, but it's still just really hard. As an infection preventionist, every day I come to work with the goal of preventing one more infection. If I can convince one more person to get that vaccine, to wear the mask, that's how we stop this. And so none of us here want you to have to experience this disease or experience the loss of this disease before you really understand the need for this vaccine. So this vaccine is how we'll slow this down. This is how we'll get our community back. This is really how we return to that normalcy. And I like to hope maybe even better than normal.
Jamie, I don't know that, I bet everyone on here, whether you're an attendee or you're a panelist here, would share the incredible support and appreciation we have for all the healthcare workers who are out there working tirelessly. The passion and the commitment that you just described, I know, is shared by many. And it's so critically important that you all know how much we greatly appreciate all that everyone's doing at Powell, at HMG, at all of the health departments, anyone who's out there, whether you're a frontline worker or you might be someone responsible for making sure areas are safe from germs. Everyone is out there committed and loyal to their jobs to make sure that we're safe. And for that, we are very grateful and didn't want to let the night get away before we said that, because that is such an incredibly important piece of what we're all here to do. We have to support you all at the same time. So that's a thank you of gratitude to everyone here on this call and to all those out there who are doing that. So thank you for that. I do have a couple other questions because we do have a few minutes left here. How are the numbers, I'm going to ask this to Jamie again, how are the numbers doing for the admissions and so forth at Ballot? I know we get great dashboards from you all daily. We can look at regions and so forth, but what's that looking like? Are numbers up, down, trending a certain way?
Yeah, so we were able to share at our press conference today, you know, numbers are trending down a little bit right now. So I think we peaked at hospital admissions around 360 something. Right now we're between 300 and 320. And so while those numbers are coming down, it is a great sigh of relief. The total positivity, the number of actual cases, that certainly has plateaued. And when we talked today, a couple of things. Decreased testing obviously it's happened over the last little bit. And so we're keeping an eye on it. I'm not here to say tonight, yes, we're on the other side and we peaked and we're coming down. I think we're at a junction that we can watch for the next little bit. If we continue to trend down like we are, I think what you're starting to see is, you know, you've got several thousand people now who've had that second dose of vaccine in their arm. You've got thousands in the region who've had that first dose that we know provides some protection. I'm hopeful the numbers that we're seeing are really a result of that, and that maybe we can kind of really start decompressing in our hospitals just a little bit.
Great. We're always hopeful as well, and good news for sure. I am going to toss it back. Dr. Moore, and I had a question I did not get to with you. If you don't mind, if I could jump back to you for just a minute. There are reports of new strains or mutations of the COVID virus. Will the vaccinations that we're seeing protect you from those mutations of the virus that we're reading about?
So far, for the 15 or so mutations that have occurred, have been tested from antibodies that were from research participants in a test tube type of situation. It is showing protection. And that's true for the Pfizer vaccine. Moderna is conducting those studies now. There may be one or two others out there that are in the process of being tested. At this point, the spike protein, the antibody to the spike protein is more than just one tiny section of the spike protein. So it would have to involve a mutation that would have to involve probably a significant part of the spike protein for it to be significantly different and then start to affect the immune response to it. That may happen at some point. That does happen with other viruses. So constant surveillance will be the key. And also the fact that they do have antibodies to be able to test against these new viral mutations is important from a healthcare perspective. The other is that the messenger RNA technology would allow a rapid ability to respond to a mutation should it occur and affect the efficacy of the vaccine at this point in time. What the FDA would do as far as requiring additional studies is up to them. But some of the technology, the newer technology, would allow a rapid response to that, which is encouraging. But so far, so good, and that'll be constant surveillance.
Very good, thank you. I do have another question. I'm not going to identify any individual. I'm going to toss it out and see who would like to take this one on. Our region has hit some pretty high positivity rates per test that we're hearing about. Why is that? Why do we think that is the case?
Yeah, I can take a crack. So yeah, one of the things that contributes to that is, you know, we've had to decrease our testing, at least in Northeast Tennessee, basically because it's the same nurses and staff are testing and vaccinating. So we've not been able to do as many tests. So when you have less tests, that actually contributes to an increased positivity. The other thing, obviously, is that there still is lots of transmission going on in the community. So I think both of those things together are contributing to that.
We do
Anyone?
also know that, yeah, you have been seeing spikes after our holidays. We saw a tremendous spike after Thanksgiving, and we're right now kind of in that post-Christmas and post-New Year spike as well. So whenever we have a surge in disease, we will see an increase in our positivity rates. There's many more people out there who are actually positive than are getting tested. So it's a combination of these factors that really does surge our positivity rates ahead.
And one thing I might add, when we first started out, we were not able to utilize widespread testing or multiple types of tests. And now with the advent of antigen tests that are very rapid, can be done in a doctor's office, and multiple other avenues, urgent cares, emergency rooms, doctor's offices, are all now able to provide this type of testing. So the first premise of disease control is detection. And testing is the way that we detect. The second phase of disease control is isolation and containment. And that's where we look at our isolation and quarantine guidelines, notifying people that they've become infected or been exposed, and utilizing those isolation and quarantine guidelines. With this, so we've got a lot more testing available, a lot of different types of testing available. And I would encourage our constituents to avail themselves of all that. It's not just the health department. So keep that in mind. If you have any symptoms at all, the first thing you should do is isolate. And then you can ask the question, well, what do I really think I have? And then set up for the type of testing that you may need. It may be flu, it may be strep, or it may be COVID. At this time, the high likelihood is that it'll be COVID, and we need to get you that testing done. So avail yourself of these other opportunities for testing. Have a high index of suspicion because the community rate of transmission is very high. And then the most important thing is practice what you know. First is isolate, and then figure out what you have, and then we can go from there.
May I add just something for the individuals who have yet to have their flu vaccination, and you're in a group that's still a few weeks away from getting the COVID vaccine. Now is a great time for you to get your flu vaccine, because you're going to have to wait 14 days before you can get the COVID vaccine. Use this time opportunity now to get vaccinated with influenza, because the symptoms of influenza, there's some overlap with COVID, and it can be taxing to the healthcare system to try to differentiate between the two. And so that will be beneficial to everybody.
I tell you, you all have been incredible tonight, and I know that our time is running nil here, so I'm going to wrap us up. Region Ahead that I'm representing tonight asks that you help end this nightmare of the COVID virus in our region. It's the best way to protect yourself and your family, and to return our region to a vibrant economy and a way of life. You might want to write these important URLs down and share these with your friends. For your parents or grandparents who may not use the internet, we ask that you share information from this appropriate site or the appropriate one for their footprint, and help get them vaccinated. Region Ahead has created a new website location that also offers some great information. Here's a reminder: the vaccination process and information are likely to change regularly. Use the websites that we have shared to get the most current information available. Vaccination is the best way to end the pandemic, to save lives, and to return us to our lives as we previously knew them, and to our strong economy that we all love. Please get vaccinated. Wear your mask and practice social distancing until this pandemic is controlled and eliminated. Have a great evening, and thanks again.